I would say, what would you like to tell families if they're having a hard time getting a diagnosis and they don't feel like Alzheimer's or another kind of dementia really fits? How would you recommend that they advocate for themselves?
So the first step would be educating themselves in terms of what are the symptoms of Alzheimer's and what are the symptoms of Lewy body. And if they feel that they are not meeting the criteria for Alzheimer's disease, then taking out time to write down what symptoms they are noticing, and if they are fitting the picture of Lewy body, trying to bring it up with your primary care or neurologist. And if you have a behavioral neurologist or a dementia specialist in your area, that can help. And these features, as we talked about, was acting out in dreams, having visual hallucinations, seeing things that are not there. Sometimes it can be as subtle as seeing a shadow pass. Yes, and that's something that we might think is normal, but seeing shadows move in your peripheral vision is also a sign of Lewy body. Having stiffness in your body where you have muscle cramping and stiffness, and having big changes in your attention levels on a day-to-day basis, where almost as if someone flipped the switch and you were very attentive and talking to someone and suddenly you glaze over and you cannot talk. So those kinds of symptoms are Lewy body symptoms. So we want our friends and families to know about these symptoms and keep an eye out for them.